Sore throats. A rite of passage for children, it seems. Almost every child will experience the discomfort of a sore throat at some point during their early years. It's one of those inevitable parts of growing up that parents and children alike must navigate. Few things are as universal as the sniffles, coughs, and scratchy throats that come with childhood. These symptoms often accompany the common cold, which is a frequent visitor in households with young children. The sight of a child struggling with these symptoms is all too familiar for many parents. As parents, we brace ourselves for these common ailments, armed with tissues and comforting words. We become experts in soothing our little ones, offering warm drinks, and creating a cozy environment to help them feel better. The role of a parent during these times is both challenging and rewarding, as we provide the care and comfort our children need. Among these childhood woes, sore throats rank high, often signaling the start of something more. A sore throat can be the first sign of a cold, the flu, or even more serious infections. It's important to pay attention to the severity and duration of the symptoms to determine the best course of action. While most sore throats are caused by viruses, a small percentage are caused by bacteria, most commonly group A, Streptococcus, the culprit behind strep throat. Viral sore throats usually resolve on their own with rest and supportive care. But bacterial infections like strep throat require medical attention and antibiotics to prevent complications. Distinguishing between the two is crucial, as it dictates the appropriate course of treatment and ensures your child gets back to their playful selves sooner. Parents should look for signs such as fever, swollen lymph nodes, and white patches on the tonsils, which may indicate a bacterial infection. Consulting a healthcare professional for a proper diagnosis and treatment plan is always recommended. The first step in understanding sore throats is recognizing that not all sore throats are created equal. Viral sore throats, as the name suggests, are caused by viruses, the same culprits responsible for the common cold, the flu, and a host of other infections. Bacterial sore throats, on the other hand, are caused by bacteria, microscopic organisms that can wreak havoc on the body's systems. While both types of infections can cause discomfort and misery, bacterial infections require a different approach to treatment. Deciphering whether a virus or bacteria is behind your child's sore throat can feel like detective work. While there's no foolproof way to tell without a doctor's visit, certain symptoms can provide valuable clues. Viral sore throats often present with cold-like symptoms: runny nose, cough, congestion, and sometimes fever. The throat may appear red and irritated. Bacterial sore throats, particularly strep throat, tend to be more severe. The throat is often very red, sometimes with white patches on the tonsils. Why is it so important to determine whether a sore throat stems from a virus or bacteria? This question is more crucial than it might initially seem. When your child complains of a sore throat, it can be tempting to seek immediate relief through antibiotics. However, understanding the root cause of the infection is essential for effective treatment and long-term health. The answer lies in the treatment. Viral infections do not respond to antibiotics. Antibiotics target bacteria, and using them against viruses is like bringing a water gun to a house fire, ineffective and potentially harmful. Overuse of antibiotics is a growing concern, leading to antibiotic resistance, a phenomenon where bacteria become immune to the medications designed to kill them. This resistance can render common treatments useless, making even minor infections difficult to treat. Imagine a world where simple infections could once again become deadly because our most powerful tools no longer work. This is not a distant dystopian future, but a very real possibility if we continue to misuse antibiotics. Accurately diagnosing the cause of a sore throat ensures your child receives the right treatment while protecting them and the community from the dangers of antibiotic resistance. Proper diagnosis often involves a quick and painless throat swab, which can be analyzed to determine whether the infection is viral or bacterial. This step is crucial in guiding the appropriate treatment plan. For viral infections, supportive care such as rest, hydration, and over-the-counter pain relievers are usually sufficient. On the other hand, bacterial infections may require a course of antibiotics to effectively clear the infection. Educating parents about the importance of accurate diagnosis and appropriate treatment is vital. When parents understand why antibiotics are not always the answer, they are more likely to follow medical advice and avoid unnecessary medications. This not only helps their own child, but also contributes to the broader fight against antibiotic resistance. In summary, getting the diagnosis right is not just about immediate relief, it's about safeguarding the future of medical treatments. By ensuring that antibiotics are used only when necessary, we can help preserve their effectiveness for generations to come. So, the next time your child has a sore throat, remember, getting it right truly matters. When a virus is calling the shots, managing viral sore throats at home can be straightforward. If your child has a viral sore throat, the best course of action is often the simplest. Provide comfort and support as their body fights off the infection. Plenty of fluids, rest, and over-the-counter pain relievers like acetaminophen or ibuprofen can help alleviate their discomfort. Gargling with warm salt water can also soothe a sore throat, though this may be challenging for younger children. Remember, viral infections typically run their course within a few days to a week. When it comes to bacterial infections, it's like calling in the cavalry. If your child's symptoms point to a bacterial infection such as strep throat, a trip to the doctor is in order. The doctor will examine your child's throat, ask about their symptoms, and may perform a rapid strep test or throat culture to confirm the diagnosis. If the test confirms a bacterial infection, the doctor will prescribe antibiotics, usually penicillin or amoxicillin, to eradicate the bacteria. It's crucial to complete the entire course of antibiotics as prescribed, even if your child starts feeling better before finishing the medication. Antibiotics are powerful tools in the fight against bacterial infections, but it's crucial to remember they are not a cure-all for every ailment. As mentioned earlier, using antibiotics against viral infections is not only ineffective, but can also contribute to the growing problem of antibiotic resistance. When antibiotics are overused or used inappropriately, bacteria can develop defense mechanisms, making them resistant to the medications that once effectively treated them. This resistance can lead to more severe infections, longer recovery times, and limited treatment options in the future. Navigating the world of childhood illnesses can be daunting, but trust your instincts. You know your child best. If your child's sore throat is accompanied by a high fever, difficulty swallowing, swollen glands in the neck, a rash, or any other concerning symptoms, don't hesitate to seek medical attention. When in doubt, err on the side of caution and consult your child's healthcare provider. They can provide an accurate diagnosis, recommend the appropriate treatment, and offer reassurance during a stressful time. Preventing the spread of germs is the first line of defense against sore throats, whether viral or bacterial. Teach your children good hand hygiene habits, frequent hand washing with soap and water, especially before meals and after using the restroom. Encourage them to cover their mouths and noses when coughing or sneezing, preferably with a tissue or their elbow, to prevent the spread of droplets. Keeping their immune systems strong through a healthy diet, regular exercise, and adequate sleep can also help ward off infections. Sore throats are an inevitable part of childhood, often causing discomfort and worry for both the child and the parents. These common ailments can be distressing, but with the right knowledge, parents can handle them more effectively. Understanding the difference between viral and bacterial infections can make all the difference in ensuring your child receives the right care. Viral infections, often caused by common colds, usually resolve on their own, while bacterial infections might require antibiotics. By recognizing the telltale signs, such as a sudden onset of sore throat, fever, or swollen glands, parents can better determine the nature of the illness. Understanding the importance of accurate diagnosis is crucial. Misdiagnosing a bacterial infection as viral or vice versa can lead to unnecessary treatments or prolonged illness. Knowing when to seek medical advice is another key aspect. If your child has a persistent fever, difficulty swallowing, or if symptoms worsen, it's important to consult a healthcare professional. Parents can confidently navigate these common childhood ailments by staying informed. Remember, knowledge is power, and being well-informed can make a significant difference in how you manage your child's health. By arming ourselves with the right information, such as understanding the symptoms and knowing the appropriate treatments, we can be proactive in our approach to our children's health. We can be the best advocates for our children's health and well-being by staying educated and vigilant. This means not only knowing when to seek medical help, but also understanding preventive measures to keep our children healthy. And when those inevitable sniffles and sore throats do strike, we can face them head-on with confidence and calm. Armed with tissues, comforting words, and a clear understanding of the illness, we can provide the best care for our children. Comforting a sick child involves more than just physical care. Emotional support and reassurance are equally important in helping them feel better. The peace of mind that comes with informed parenting cannot be overstated. Knowing that you are doing everything possible to care for your child brings a sense of calm and confidence. So, take the time to educate yourself about common childhood illnesses. Read books, consult reliable online resources, and don't hesitate to ask your healthcare provider questions. Open communication with your child's pediatrician is essential. They can provide valuable insights and guidance tailored to your child's specific needs. Ultimately, an informed parent is a confident parent. By staying knowledgeable, you can ensure your child's health and happiness, allowing them to thrive and enjoy their childhood to the fullest.